am tremendously impressed with what Dr. Lantos has done and what Children's Mercy has done, the resources that they've put into this and made it possible for dozens of people already around the country and in other countries to deepen their understanding of bioethics as it relates to pediatrics.
It's exciting and it's fun, and it's very well coordinated, and I think it could benefit anyone who's working in the medical profession.
We were all enriched by each other's perspectives.
The books that we read were incredible.
Throughout the certificate course, we cover fundamental topics unique to pediatrics, including the best interest standard, the avoidance of harms, looking at basic ethics, precepts, principles, and positions in discerning right action on behalf of children, both by children who have the capacity to make such decisions, as well as by their parents. We look into legal ramifications, we look at end-of-life and beginning-of-life issues, research ethics, adolescent medicine concerns, and much, much more.
The course is specifically not just for doctors, but for anyone really that works at a pediatric facility and has an interest in the ethical issues that arise in giving health care to children. We've had a number of different kinds of doctors, but we've also had nurses, social workers, chaplains, and other staff members at hospitals from the United States and even internationally.
Electronic platform worked very fine for me, so we had good discussions.
I think a lot of people are afraid of e-learning, and I've actually, when I got my master's, I e-learned as well. But it actually is really a good way to communicate. And I think it's great in that you can have people from all over the country, as well as different parts of the world, all learning together and all teaching each other. And so I think e-learning gives you an opportunity that being actually at the site doing the course does not give you.
The topics I found most interesting throughout this course were definitely the palliative care topics, moral distress. Those are things that we're dealing with currently at my hospital, so I was very engaged in those topics.
In my seminary career, we didn't really have an ethics class or ethics program. So this has given me a new vocabulary and a new way to discuss some of the situations that we find ourselves in the hospital.
I learned so much from the students. People come from so many different backgrounds, so many different professions, and bring so many different insights that the discussions are endlessly fascinating.
The approach is deliberately multidisciplinary is extremely important because there's no one discipline either that can understand the whole problem or that can address the whole problem. And I think that the idea of bringing together people with different disciplinary backgrounds, opening the opportunities to expand their horizons to look at further disciplines is absolutely the way to go.